Hello everybody, welcome once again at the Vitrolife Group Academy Studio here at ASRM in New Orleans. I would like to present Dr. Robert Green, who is our next speaker, and he's going to tell us about how they've been working with EmbryoGlue over the last years. Dr. Green, thank you.
Absolutely, thank you. You know, it's interesting as clinicians, sometimes we don't spend enough time talking and communicating with our embryology teams, but I think it's a great reminder for all of us that when our focus is on the one measurement that matters, which is pregnancy rates and live birth rates, I think it's important sometimes that we have to go back and emphasize some of the things we've been doing that have been really working. You know, a lot of times we're criticized in our field for not having perfect data because we don't always use prospective randomized studies. But very often we have something that is biologically plausible that is started for various reasons and found to be useful. And then we have the opportunity over the years to review the data and see whether or not our original assertions were in fact accurate. So what I want to do today is I want to talk about some of the things that have really been thought about as ways for the lab to help facilitate the clinical outcomes of pregnancy rates and live birth rates. And in comparison, there have been many things over the years that have been looked at as ways of trying to optimize implantation and the new term that people are using, placentation, that early development of the placenta. And we're finding that not only may that correlate with our pregnancy rates, but also with our miscarriage risk, and potentially even with some pregnancy-related complications, which have also sort of haunted our patients over the years. Now, if you look at, recent evidence, when there was a comprehensive review looking at 38 different outcomes that have been considered add-ons, there's 3 that really stood out as optimizing our clinical outcomes. And again, we have very clear outcomes: pregnancy rates, live birth rates, miscarriage risks. And when these things occur, it's not news breaking because it's very often things that we've been doing, but that doesn't mean that it's not newsworthy. So I want to take a few minutes and highlight some of the data that's come out about hyaluronic acid and the product EmbryoGlue that can be used to help facilitate what we're all trying to achieve, which is healthy outcomes. Now, hyaluron is a complex macromolecule that we're finding has more and more correlation with health and wellness. If you're looking at various outcomes that are associated with aging, we're often finding that there is a loss or reduction of this important chemical. It's been shown to be an important lubricant. We all hear about dry eye syndrome nowadays. And interestingly enough, there's even talks looking at this as being one potential marker of ovarian aging is loss of hyaluron. But this was proposed many years ago because it's been shown to correlate with embryo adhesion, that first step of attachment. It's been correlating with early development, and studies have also shown improved survivability for embryos that are cryopreserved. So added as part of a nutrient-rich medium that has already been popularized for its versatile applications, it makes sense that when you look at this and you actually correlate it with the clinical outcomes that we're looking at, it becomes more and more inherent that we understand that even though we don't have one single precise mechanism for how this works, it was originally proposed for its biological plausibility. It adds miscibility, it adds the ability to optimize the adhesion, the attachment. And importantly enough, people are starting to look now at CD44 receptors and how changes in this important receptor and its ability to bond with this molecule might be correlated with some of the adverse or poorer outcome patients that we've all struggled with, looking for newer and better ways to improve pregnancy rates for. So in terms of the supporting data, one of the go-tos, especially for things that have been around for a little bit, is Cochrane review. And most people are kind of aware that this is a group that is independent of private industry. What they do is they're a group of clinicians and researchers that look at existing studies. We know that every individual study has different flaws. We always talk about strengths and weaknesses of individual studies, whether it's the patient population or the study design or the analysis. And one of the most effective ways we overcome these individual study weaknesses is by grouping studies together. And by doing so, we're able to get larger data sets that represent more diverse interests in terms of patients as well as researchers. And this is something that's been around long enough that originally it was reviewed twice previously, and then more recently has been updated so that we now have a collective of 26 studies that involve over 6,500 patients in using this product. And what they found is that clearly we're seeing higher pregnancy rates, and we're also seeing higher live birth rates. And it's for this reason that recently at ESHRE earlier this year, when they were looking at add-on treatments, they were looking at a combination of things that have been evaluated over the years, some clinically, some in the laboratory, trying to determine which ones of these things should be applied to, larger clinic populations. And one of the most important things that they found is that an add-on needs to be able to be applicable for most patients. Otherwise you have things that might be appropriate in a limited patient population, but looking things that might have broader use and greater correlation over larger patient populations. And this is, in comparison to many of the other things that have been proposed over the years. Some of them still may have clinical validity, but we don't have enough data yet to support them as being things that should be widely applied. But clearly hyaluronic acid is one of the only treatments that actually got the recommendation, meaning that it could be used in a wide population. But now we're also finding that it may even be more broadly beneficial in some of the most targeted populations that we have to deal with. And these are the patients that are over 35, which represents a large portion of most of our clinical practices. It includes the patients that have recurrent implantation failure, and my goal is to always prevent them from reaching that diagnosis. And I'm pleased to say that we've been using this for many years, and so this is not a population that we later talk about including this on, because we're using this pretty broadly in our clinical setting. And the patients that have no good quality embryos or no GQE. And in these particular patient populations, it's been shown to, again, correlate with higher pregnancy rates and higher live birth rates. And again, the data is broken down for people that are still doing day 3 transfers, for those that are only doing day 5 or day 6 blastocyst transfers. Also, we're also finding that in the recurrent implantation failure pregnancy patients, there may even be a reduction in miscarriage risks. And more recently, there was even the suggestion that there is a higher risk of multiple pregnancy. And I think that's a good wake-up call for us clinicians to continue to stress and push single embryo transfers every opportunity we can. Finally, talking about another emerging patient population that might find this especially beneficial. Previously, it had been found that CD44 receptor that this molecule binds to seems to be somewhat deficient in PCOS patients, which has prompted additional research looking at applying this specifically to the PCOS patient population. And here again, we're finding clinical benefits that correlate to higher pregnancy rates, higher live birth rates, and also potentially reduction in the risks of miscarriage. We always have to be aware of costs based on US data. I don't know why my graphic isn't appearing, but it has been shown to add cost like everything we do. It's estimated to be roughly about 2% of the overall cost of an IVF cycle as averaged in the United States. So there is a slight increase in the patient cost, but as we all know as clinicians, the greatest cost is an unsuccessful cycle. So anything that might save us from that is probably well worth it to most of our patients. Anyway, I do thank you for your attention. I know that this hasn't been brand new information for most people, but hopefully it's been a nice update and review and something that you could find to be clinically useful for your patient population as well.
Okay, thank you very much. Any questions from the audience on stage? Just a quick one from my side.
Yeah.
So you use it routinely for all of your patients as a standard protocol?
Yeah, at our center, all of our patients do it. Not only are we using it very liberally in the lab, as a clinician who often gets shooed out of the lab, I'm always in there asking what they're doing. They've even paid attention to some of the more recent data that shows that extended culture for frozen embryo transfers prior to transfer is correlated with higher outcomes. I may even have one more graphic, but there it is. That's our, not our data, but the internal data that shows that, incubating the embryos for a bit longer, we always do a viability scan at our center. So we always saw the embryos, at least a couple hours before transfer to ensure that they look good. But again, some of the newer studies are showing that a more extended culture is correlated with higher attachment and implantation rates. So again, we're still learning better ways to apply this and finding that the more we pay attention to detail, the better we're getting at it. Yeah.
Dr. Green, thank you so much.
Absolutely.
For being here today and sharing this information with us.
Absolutely. Thank you.
Thank you, everybody. Thanks for tuning in. See you next time. Bye-bye.